Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update, and I appreciate you joining us here today. Just wanted to talk a little bit about the Delta variant and whether or not to wear that mask. Well, Delta, as you know, is from India. Was first noticed here in March of 2021. Right now, it's the variant of most concern, even though the variant from the UK is the most prominent variant across the United States. In some places, such as Springfield, Missouri, they are in the midst of a surge right now, similar to what we saw in January of this year. A hospital administrator there said that almost 100% of those hospitalized were the younger, the healthier, and the unvaccinated. The vaccine does not prevent a mild COVID-19 infection in everybody, but it definitely has been shown to prevent severe disease, hospitalization, ventilator use, and death. That means that many of the Springfield hospitalizations were preventable with the vaccine. And we say all that to say this. While things are so much better, remember to protect yourselves and your families. Get vaccinated. Wash your hands frequently. Wear masks indoors in large crowds, whether you're vaccinated or not, and continue to monitor your distance. Let's consider some of the risks and benefits of masks. It can be hard to know what to do because some businesses require masks still, even though the CDC says we don't have to wear them, except on public transportation and in healthcare facilities. According to the former CDC director, Tom Friedman, many of us are probably asking ourselves, am I really safe if I take the mask off, even if I'm vaccinated? How do I really know if all the people around me are vaccinated? What about the Delta variant? And should I wear the mask even though the CDC says I don't need one? Well, it depends. There's some things you should consider in making that decision. Number one, the pandemic is ongoing. It's not gone. The variants are spreading. And masks, of course, are a proven way to reduce the risk of getting a severe infection. Here's some additional questions to ask yourself. Who are you? Are you fully vaccinated? If you have had both Moderna and Pfizer shots, the first and the second, and you're 2 weeks past those shots, the second shot, then you are at least 88% protected against the Delta variant. Unvaccinated persons and those who have not had both of those shots are not protected. The Johnson & Johnson is about 66% effective, and that's actually pretty good. It's kind of like the flu shot's efficacy. Another question to ask is, are you immunosuppressed or immunocompromised? Do you have a weakened immune system from medications or medical conditions? If so, vaccinated or not, you should talk with your doctor because extra precautions may be necessary. Another question, do you live with someone who is immunocompromised or immunosuppressed? Do you care for someone like that? If so, you should be wearing a mask for their protection and yours. You should get vaccinated for your protection and theirs. Where are you is another question to ask. Where are you? Are you in a high incidence area? Now, Davidson County is low incidence. Fortunately, we're doing fairly well, and hopefully we'll continue to do so. However, in public settings, we don't know who is vaccinated, who's not, where they've been, who they've been with. So in many indoor public areas, Especially when there's more than just a handful of people, masks are recommended. Speaking of high incidence areas, be sure you know the area that you plan to travel to if you're traveling, because you want to govern yourselves accordingly. Another question to ask is, what are you doing? Different activities present different levels of risk. Consider the amount of aerosols produced from people talking, laughing, singing, or breathing hard. Consider wearing a mask at indoor sports events for this reason: choir singing, gyms, indoor concerts, graduation ceremonies, and other places where you feel like there's a lot of aerosol production. Dr. Friedman went on to say that we are in a society where mask wearing is frowned upon. Ideally, no one should get on an airplane, a bus, or a train when they're sick or coughing, and if they do, they should wear a mask, especially right now. And the rest of us, if we are on that plane and choose to wear a mask, there shouldn't be any ridicule toward us. In some Eastern Asian countries, masks are worn during flu seasons and anytime they feel high risk. The pandemic was required for us in the United States to understand that some of the public health practices that we use to slow the spread of COVID-19 should have already been our norm. Washing our hands frequently and possibly even wearing a mask during flu seasons and other high-risk times may need to be part of what we consider our new norm. That may keep us all healthier. Just a thought. Thank you for listening, and as always, stay safe, stay healthy, and stay prayed up.